So, in a minute, you guys will be getting your checkoff sheets for respiratory. We will have time today for you to practice this at least once or twice on each other, and then we can do checkoffs for head, ears, eyes, nose, throat for anybody who does not have that done yet. And if you want, if we have a chance to get to it, we can do this as well. Okay? This is a super quick one because we're just doing the one system. The lungs are complex, but as far as assessing them, they are not. Okay?
You have to say what you're listening to, though.
Yes. So, we've washed our hands, we've introduced ourselves, we've identified our patient correctly, we verified their allergies, they don't have any, thankfully. We only need our stethoscope. We don't need to worry necessarily about a pulse oximeter at this point because we've already gotten the vital signs and everything came out looking good. Okay? Now, if I was going in there and my patient was looking like, okay, would I want to maybe reevaluate those? Yeah, okay, because they're not matching what I was told. So I'm going to look at my patient during their general survey and just see, do they look like they're having to work to breathe? Do they look tachypnic? Are they diaphoretic? Okay, what's their skin color? And I don't mean, you know, black, brown, orange. I mean, do they look cyanotic? Which means what? Blue, or poor pallor, okay, purple even, okay? So I'm going to wash them for at least 2 or 3 at the most respiratory phases. Okay, so in and out, in and out, in and out before I even say anything else. Okay, I'm going to verify their oxygen saturation if I need to. Inspect chest symmetry and work of breathing. So now we can take their, letting them know why, but taking down their gown and just watching to see if they're using any of these serratus anterior muscles. Remember that muscle group in A&P? The one, some people are like, what the? Get out of my way.
I don't know.
Okay, so you know all the hot guys out there that they're always and they have those nice muscles right here. Okay, those are flexed, by the way. That's why they're doing this. But that's what these are right here on the side. They help with breathing as well. Okay, they're anterior serratus anterior or anterior serratus.
Anterior serratus.
There you go. But right here on the sides. Okay. So we want to see if they're utilizing those, because if they are really working to breathe. We shouldn't see those things flex. Okay. We should also not see their abdomen here kind of concaving in, because again, that's more pressure or more work of breathing that they're showing. Okay. We want to make sure too that the ribs are rising and falling together, not inadequate or
seesawing.
Seesawing, because that could mean they've got chest trauma, broken ribs on one side, and then it's all wobbly wobbly. Okay, so we want to make sure to look at that. We want to make sure, of course, there's no punctures or anything. Make sure the skin's all nice in one color. If they have body hair, that it's decent, you know, as far as distribution. Thank you. I don't know why I am having problems today. Maybe I'll go get checked for a stroke.
Not again, please.
What do you mean? No. We're going to percuss, and well, first we're going to palpate and see if there's any lumps, bumps, or anything that shouldn't be there. Notice, well, I shouldn't have gone that far down because that's abdomen right here, but right throughout the chest area. Okay. We also, aside from the front, we want to look on the back. Okay. Now, granted, we've already done integumentary assessment, right? But we still want to look to see that yes, the ribs back here are moving adequately as well. Okay, there's no skin breakdown or anything like that. There's no lumps, bumps, rashes, lesions, or anything like that. Okay, now comes the fun part. Oh, forgot percussion. So percussing, you're going to use both hands when you percuss. Palpating, you can use both hands. Just don't, you know, like this. But with percussion, you're going to take, I usually use my middle finger because it's a little thicker than my other 3 here. Okay, but I'm going to try and feel for that area between the 2 ribs. And I usually, you want to start up top here. Okay, and I'm just going to, ooh, that sounds different, didn't it?
Which
That's
one do
what
you
we're
want to hear?
Yeah, which one do you think we want to hear?
That one. That one. The bottom.
This one.
Hollow.
Nice and hollow. Okay, because if you hear this, you're either over bone or that part of if you know you're in between the intercostal muscles and you're palpating or percussing the lungs and you hear that full sound, they either have no lung there anymore because it's been removed from a surgery, a lobectomy, or it's full of fluid, whether it's pulmonary edema or mucus or sputum or what. Okay, inflammation. So you definitely want to hear that. And I'm going to go down all the way down in between each rib on both sides. I can also do it on the back as well. Again though, this is going to be a little bit tricky. You're supposed to be able to do it between the shoulder blades. I have never had it successful with that. Okay, and so I always start at the bottom of the shoulder blade or the scapula and then work down the last few. Okay, mainly because there's such a finite amount of space in between the end of the scapula and the spine.
Yeah, because they tell you can have them hug themselves, but there's still the spine and that very finite space there. Unless you got spindly fingers to do it, then you can't.
Yeah,
and
someone
it's very
like,
hard.
and I don't mean to pick on you, but someone like Gabby who's very small framed, even if she was to wrap her arms like this and open up her shoulder blades, it's still a small area.
Tiny space.
Okay. You would have an easier time on men, mainly because we typically have broader shoulders and we can open those up a little bit more. But typically, smaller framed women, you have a harder time. So just go below the scapula and percuss that way, okay? Now comes the fun part. So remember, when we're auscultating and evaluating something bilaterally, we are doing what?
Comparing.
Looking for symmetry. Well here, now that we've already looked and inspected, now we're gonna listen. We're gonna add that other element there to symmetry, okay? So you wanna start up top, right below the clavicle up here, because then you are listening to what part of the lung?
Right upper.
Healthcare professionals call it what? Starts with an A. The what?
It belongs to your heart.
I was going with apex.
Same part of the heart.
Yeah. Okay. Down here would be, this is the top, the base. Okay. All right. So
Trying
we're
to
gonna.
make it easy.
Yeah. So we're gonna start here and go side to side, and really, it doesn't matter if you're gonna go zigzagging or if you're gonna snake across. Okay. The main thing is that you're listening to one side and as close to the exact point on the other side. Okay. All the way down, and once you get past right around here where the base of the ribs are, okay, you're no longer listening to lung tissue, because guess what? You're in the abdominal cavity at that point. Okay.
Done past the diaphragm.
Yes. If you are listening up here and you hear gurgling, that's an issue. We
Amen.
shouldn't really be hearing that. They might have had a herniation of their from their intestines through the diaphragm into their chest cavity, and that's an issue. Okay.
Then we'll be asking a whole lot of other.
Yes, whole other things, which you won't get on your assessment check off. It won't be that neat. Okay. Now that's just the front. We have laterals on the side, and we only listen to one set for those. Okay, and you can listen from the anterior position or the posterior situation or position. It doesn't matter which, as long as you evaluate those. Okay, and that's right here, the last rib. You should feel like a false rib right here. You want to go one more up from there because that's the last true rib, and you want to make sure you're auscultating there. Okay. And if we do it on the front, we got to do it on the back. Now this is kind of hard to show on here. My favorite little demonstrator. Well, she sits right in the front row in class too, so I'm always picking on her. Okay.
She's always being.
Right. So we have the shoulder blades right here on this side and over here, right? Well, we can't exactly listen right here because we can't listen or auscultate through bone. Okay. So instead of going all the way over here, we're going to start just above there, come over to this side and listen for at least one full respiration before we moving to the next. We're not going to come all the way over here. We're going to come up to that, what I call the west coast of Africa, okay, or the coast of Africa, if you will. Now, you know, you've got some support there, but listen for one full respiration, come across this way, and keep on the outside of the bone there. And then once we get to about right here at the base, you can kind of feel where the bottom of the rib cage is. That's your last set, okay? Then you would take your findings and document them. Now, if I'm listening here on her posterior side, what type of breath sound should I be listening for?
Bronchiovesicular.
Bronchovesicular. Okay, because remember, right through here would be bronchial, bronchovesicular, and then still everywhere else, vesicular. Okay? Perfect, thank you. And that's it. Other than making sure that you put the gown back and cover them up, okay? If they want it left down, that's up to them, okay? Lower the bed to the lowest end.
Something's happening.
What?
You're caught
Come
on
back up.
something.
Coming up, coming up, coming up, coming up.
Part with that table, would you?
Ah, nice catch, thank you. But the bed should be in its lowest and lowest and locked position. Side rails up. Okay. All right. Any questions? Okay. If they were on any type of supplemental oxygen, which we will get into in a couple of weeks for oxygenation and perfusion, you would also want to note that along with that documentation thing that I should have gave you guys earlier. Okay? Because you want to note the flow and how it's being delivered. All right. All right. Let me go ahead and give you guys until 1:45 to practice on this, and then we can start doing checkoffs for head, ears, eyes, nose, throat at